Hello, I am Dr. Pearlstein, and I'm here to talk to you about stretching for pain relief. I'm glad to see that you're here because you're taking the first step towards making major changes in your life, towards making a better you. You know that every moment is a new day, every day is a new day, every month and year you have the ability to start again. Now's the time to make major changes to make yourself the best you can be. I'm here to talk about care of your body and your whole person too. But the main thing, care of your body, and particularly the muscles and joints, where many of you have had pains, have had problems involving various areas. Could be your neck, your shoulders, your low back, your knees, and other areas. And you don't know what to do, or you don't know who to go to see, you don't know when, you don't know if what they're telling you is the right thing. You're afraid of tests, injections, surgeries, treatments. Maybe you've had things done and you don't know if you're in the right place or optimized for where you should be. I practiced medicine for 30 years. I practiced orthopedics for roughly 25 years. And I think that I am in the right place to offer you some information that may be very helpful. And that information is on this website and in the videos and the modules we have to help you with a stretching program which is unique, simple to learn, easy to put into practice on a daily basis or certainly a regular basis, and will make major changes in your life. I have a background going back to college days. I have a degree from Princeton University. I went to medical school at New York University School of Medicine. I then did a general surgery internship and then an orthopedic surgery residency at State University of New York at downstate Kings County in Brooklyn. I did medical school with an Air Force scholarship. I served 4 active duty years. I finished as a major in the Air Force. I was at Clark Air Base in the Philippines and Andrews Air Force Base in Washington, D.C., and then later served in Persian Gulf 1. And I was in practice for many years and practiced in private practice, in group practice, in multi-specialty practice. I did workers' compensation, I did personal injury, and of course my military days. I practiced in many capacities. My practice started in the Air Force, where I was paid a salary and was concerned for the health and welfare of the patients and the people on the base. It wasn't about doing more procedures or making more money. And I carried that into my private practice and civilian practice, and in fact was very surprised that many procedures were done based simply on MRI results or X-ray results without spending the extra time to really understand what was happening with the patient, you, and to determine the best process of getting the best result for the person. There are a number of problems that exist in healthcare and with musculoskeletal care. These problems are, number one, a lack of education on the part of the public and individuals, patients, to know when they have a pain what the cause is. There are many possible causes, and they don't know. One of the reasons they don't know is because we live in our bodies. We each have a neck, a low back, and the muscles and joints, but we generally don't do any healthful or curative process for that body part. So if I asked you, what do you do for your neck on a regular basis? With many people, the answer is that they don't do anything. So we're not familiar with these body parts, and then we get into our 30s, 40s, 50s, we start having pain, and we're unfamiliar. And we're fearful because of things we've seen on TV and infomercials and the web and heard from doctors. And the question is, what's true and what's not true? So one problem is knowing what we're dealing with. Another problem is, what do we now do? When should we do something? If you have pain on day 1, should you go to the doctor day 1? Or can it wait? And is there a process to take care of yourself? What is that process? What things should you know to do yourself? Going forward, who do you go to? What kind of doctor? There are so many different types of doctors, from orthopedics to neurosurgeon to neurologist, acupuncture, chiropractor, physiatrist, anesthesia, pain doctor, so many different types. Who should you go see? How can a given problem have so many different possible people and solutions to offer? So these are all things one needs to know. Are there maintenance programs, helpful programs that we can do? We use our Q-tips for our ears, we brush our teeth, we brush our hair, we do things for self-maintenance. What do we do for our muscles and joints? This course will offer you those solutions. There are a lot of different tests and procedures out there. How do we know what's appropriate for our problem and for us? And if a doctor tells us to do a certain procedure, test, or surgery, how do we know if it's the right thing? How do we know what questions to ask the doctor? Again, these are all questions that will be addressed in the teaching videos in this website. And I'm glad you're here to share the information that I've spent 30 years developing and putting together. Certainly there are many other problems, and I'll try and address them. I'll make an analogy. If you own a car and you have a problem, do you know what the source of the problem is? Do you know what part of the car is malfunctioning? Do you know how to fix it yourself, or do you go to a mechanic? When you go to a mechanic, how do you trust what he tells you? Is it blind trust? You just have faith that the mechanic knows? He's in business. He's making a buck. How many times do you feel that they're telling you that there's more that they have to do to effect a repair, or more jobs that they have to do, and more money that you have to spend? The same thing exists in healthcare. In a similar way, negotiating to purchase a car, you have to know who to go to, what car is the best car, who to buy from, what's the best time of year, best month, best day to get the best purchase price. These are secrets. Well, in a similar way, there are secrets to navigating healthcare, and in particular the field that I'm in, orthopedics, dealing with musculoskeletal care, which involves the muscles, the ligaments, the joints, the tendons, nerves as well. There are secrets that you'll get from this course. I'll just share a little story. There was a gentleman walking down the street, and he saw a stranger bent over looking on the street. And he thought the gentleman needed help, so he went over to offer help, like many of us would do. And he said, "What are you looking for?" And the gentleman bent over and said, "I dropped my keys and I can't find them." So he said, "Do you want help?" And he said, "Sure." So the fellow bent over and started looking for the keys as well. And after a considerable time of looking for the keys, nothing was found. So he said to the first one who lost the keys, he said, "Are you sure you lost your keys here?" And the gentleman said, "No, I lost them over there." So the one helping said, "Well, why are we looking here?" He said, "Well, the street light is here. There's more light here." So in a similar way, we don't want to be looking where we don't have the light to find the solutions to our problems. I'm here to bring some light to your problems, to help you find the solutions that you really need. And I think are packaged in this set of videos and this website in a way you won't find anywhere else. The solution that you're going to find here is education that will allow you pain prevention, pain relief, and a better state of living so that you can be happy and have joy in your life. Click the button below and you'll be privy to all the secrets and solutions that I have to offer. I look forward to seeing you on the inside and help you prevent and relieve all your pain.